Hi guys, this is Dr. Loveleen Sood here, and I'm super excited because I'm in New Delhi, India, and I am with Dr. Anjali Huda Sangwan. She's an internal medicine physician who is also a obesity and nutrition specialist. And your office also deals with longevity, which is also interesting because I love that word. I don't like anti-aging, so I like the longevity word.
Thank you
So I'm so excited to meet you.
so much.
And so I myself have suffered from being a chubby girl like all my life. Like, recently I lost about 30 pounds, which would be what, like 13 kgs?
Yeah, 13 kgs there.
And so I have the tagline to the movie trailer of my life is I just want to be a sexy old broad.
Why
So
not?
if you were to have a tagline, what would it be?
Healthy. I want to be healthy and healthy. I don't want to be thin. I don't want to be fat. I just want to age gracefully.
Yes, I love that. I love that. I don't like that word anti-aging. I always say aging gracefully, and I love that. So now Dr. Huda, on a perfect day, like we all go through phases where we're healthy and we're not healthy.
Yeah.
So when you're in your healthy frame of mind, what is an ideal day of eating and exercise?
I would have a good breakfast, rich in proteins, which is pretty much every day, and lunch, which is mostly raw vegetables or salad. Make sure it's alkaline food. Make sure there's some protein. Evening, I would definitely have some little bit protein, but then a workout of 2 hours is definitely gonna happen.
Wow, 2 hours.
Yeah, it takes about that much time, and if you do the warm up, the stretches, and in between, so it's about 2 hours of workout, and that's an ideal day, and that's most of the days.
Okay. So like, for example, what do you have for breakfast?
I usually have, I definitely have a scoop of whey powder before I
Okay.
start my day,
Mm-hmm.
and I have some complex carb like oatmeal, or I do a lot of overnight oats,
Mm-hmm.
and eggs. Sometimes it's fried egg, sometimes it's full egg, sometimes only egg whites. So it's a variation of eggs. And 5 times a week I'll have eggs, and a couple times a week I just straight go to brunch if it's
Okay.
yeah.
Mm-hmm. So, like you'll have lunch at like approximately what time?
2.
And then
2, yeah.
how about dinner?
Dinner's about so since my gym time's in the evening, so usually I eat and go. So I eat my dinner at 6:30.
It's a good time.
And then I go to gym around 7:30,
Mm-hmm.
and then 9 till 9:30 I work out. So yeah, that's it for dinner. Then definitely after the gym I take it another week.
Oh, okay.
Yeah.
And you're not hungry like
No,
that late
in
in the
fact
night?
post gym I'm not hungry at all. I have to force down the whey powder. into me.
And how do you like I'm not familiar, like I know I recently started strength training, so they're always telling you about whey and protein substitutes and all that business.
Yeah.
So
Yeah.
what is it about whey? It's just a straight protein?
It's a straight protein. It's easily digestible. It's very good for longevity. It's one of the it's been touted as anti-Alzheimer's. So
Oh really?
Yeah.
Anti-Alzheimer's.
Yeah.
Mm.
So whey protein is very good for health, especially if you're into strength training. That's the easiest way to. It's lactose free, and there's so many vegan options. You don't have to actually have the milk products with it, so you can have just the vegan proteins and the powders, the whey, the vegan whey. And I don't even know if it's called whey. It's just vegan powders, I think.
Yeah. No, but I've
Yeah.
seen whey, so
Yeah.
I was curious about this, especially as a woman, because I think there's a lot of misconceptions about what women should be consuming and protein and all
No, I
that.
think it's so essential. Most of the people are underdoing proteins because they just. I think proteins have a bad rap. That's all. Everybody boils down to saying, "Oh, protein's going to injure my kidneys," but it doesn't happen like that. If you're working out, you're injuring your muscle. You need to replace it back,
Right.
and you have to do it. And it's for a person who wants to just live, it's 0.8 grams per kilo, and if you're working out, it's 1.5 grams a kilo. So that's a lot of protein to have.
So it's 1.5 grams
Grams
of
per
whey
kg weight.
per kg per person. So
Yeah.
and that's specific to women, or
That's usually to people who do good amount of strength training, but there's another level to it. So people who are into like really high heavy lifting, so there it becomes 1.2 times per pound.
okay?
So that's a lot.
Interesting.
That's about 200 grams of protein.
Now, do these people need to monitor their kidney functions?
Not really. I mean,
Okay.
usually proteins are not. They're just touted to be bad. They're not. No, unless you have a kidney injury
Yeah.
before starting it.
Yeah.
Only then. Otherwise, no.
Okay.
Yeah.
All right. So I see that you were a national level swimmer through high school, and then with marriage, children, you had gained quite a bit of weight, and the pressures of residency and all this.
Yeah.
So I guess that put you on your journey,
Yeah.
and you had done a obesity medicine and clinical nutrition fellowship.
Yeah.
So what exactly is that?
So it basically revolves around it's bariatrics basically. So we are treating people pre and post op bariatric surgery, and also doing conservative weight loss, which involves medications. So you know that America has a lot of medications for weight loss, and India has none. And so we just have a couple who are on, and so we're just trying to make sure that people, and also there's also malnutrition cases you see
Sure.
there. So clinical support means you're giving the people. It's not a dietitian sort of a job, not a nutritionist. It's just clinical nutrition, knowing background of nutrition and applying it to patients that who all have medical problems. They come to you, so you apply the clinical nutrition aspect. But in India, what I face is that we end up making a lot of diet charts, because I think it's like a lot of diet. Dieting is a word which is very common here, but essentially it was never like that. You just include the food groups. In people who are overweight are also malnourished somewhere.
Yeah.
So it's basically to nourish their bodies, and the side effect of that is weight loss. So that's how it should work, but we do a lot of diet charts also.
What is a diet chart? It's like a food
It's
log?
like, yeah, it's like a food, you make like a menu for them, like Monday, Tuesday, Wednesday, you tell them what to eat for breakfast, lunch, dinner. So I like to go by principles, but most of the time I'm doing a lot of detailing, like eat this much of oats and have 2 chapatis and this much vegetable. But eventually, I think after 3 months of package, when someone's just done 3 months of coming and going to me, in the end they realize that basically it's principally what you eat. You can never do like dal today and a sabji tomorrow, and like it's every household has their different kind of, and sometimes you don't even have the groceries at home. So what do? So you understand the principle of eating.
Okay.
That's what I work on.
Okay.
And protein, vegetable.
Okay.
Like that, yeah.
You work on like that combination of protein, fat, carb, like that perfect.
Like a plate method.
Yes.
Yeah, like choose my plate.gov. There's
Yes.
So I work mostly on the plate method, telling them if you go to a restaurant, you're not going to eat what I'm telling you, but you have to choose. So when you choose, you need to know what are the principles. So you can't have a whole bowl of pasta, which is just carb. You must have a vegetable, you must have a protein with it. So that's a meal. So they work on principles. I work on principle, and eventually most of my patients end up learning that. Some don't.
Yeah.
There are always cases like that, but usually it's principles.
Yeah. So like I find for myself, because I've struggled with weight all my life, and like for me, diet is a 4-letter word.
It's
You know
a
what
very
I'm
bad
saying?
word.
I don't like to use it anymore. I like to say healthy lifestyle, and I just the words that make me happy.
Yeah.
But I think one thing that I'm trying to work on is to keep my cravings in check, and that is keeping your insulin levels
Low.
from spiking.
Yeah.
So it is key, I believe,
It is.
in long-term control of weight. And I just decided, no, I can't do this anymore. I can't torture myself. I have to get this under some type of control, and that starts with the cravings and keeping that insulin spike from happening.
Yeah.
So now I'm just curious. Oh no, this fellowship, how long was it?
It's a year.
Okay.
It's a year. It's non-accredited at this point, but it's getting accreditation because obesity medicine has been also recognized by the boards. And so American board of board specialties, they're also doing they're taking it under the, so obesity's become a disease now.
Yes,
You
yes,
can
yes.
bill for it.
Uh-huh.
So in India, still we're struggling with the part. We're still struggling with making it like a disease. People are not going to specialists. They end up going to a gynecologist or a liver specialist for reducing weight, or a dietitian, for example.
Right.
But they have medical conditions which need to be addressed.
Right.
So yeah.
What a lot of people don't understand when it comes to diet is and nutrition. Like, we took nutrition in medical school, and people don't understand that it is extremely difficult. It's all biochemistry.
It is.
And it is not like, you just learn, you eat this food or that food. It is very science-based, and it's extremely difficult. So, that's impressive that you actually did a full year of that.
Yeah, we did that, and I practiced in various ICUs in Morristown and Summit, and I remember.
Where did you practice in Morristown?
Morristown Memorial.
Okay.
Yeah.
Did you ever work at Hackensack University Medical Center?
No.
Okay. No, because I did briefly.
Yeah. Okay. No, so I went. So we used to go to the ICUs, and it'd be like, oh, so you're the diet doctor. So yeah, this to make fun, but we were actually doing the parenteral nutrition formulations, actually formulating them. And it's like biochemistry.
It's very difficult.
Electrolyte imbalances and all, I know the nephrologists do that all the time, but somebody who's going through let's say small bowel surgery. All right, where a nephrologist is just going to do the potassium and whatever, but you manage that through the parenteral nutrition.
Right. It is. That was in my medical school. Nutrition had a huge fail rate. I know it's surprising, but because it was all biochem.
Yeah, it is.
So now you've practiced medicine in the States, and you've practiced it in India. What do you find are the main differences in medicine between the two countries?
So the thing is, in America, everything has got a protocol, which is easy to follow, and we know the patient comes with a certain problem. This is what you have to do. So step A, step B, step C. Here, I see a lot of guesswork happening. So it's like, oh, hit and try. It's not hit and try. So a lot of guesswork happens, but a lot of people are following protocols also. So it's a mix and match. The patients are not as aware of their disease till it really comes to the end point. Whereas preventive healthcare is so much higher in America, and here we don't have much of preventive.
Well, I promise you, we're not exactly succeeding in prevention in America either.
But at least there is a task force.
Yes.
You
Yeah, I got you.
USP, what is that?
USDA?
The US Preventing Task Force.
Okay.
US Prevention Task Force. That's a huge body in America. We don't have that.
Mm-hmm.
We are lacking. So I think we're basically trying to prevent unnecessary pregnancies and tuberculosis right now. We're not seeing so many other cancers, and we're not doing it on. We're not trained to do that.
I got you.
As internists, we're not trained to do that. There, if a woman of 40 walks in, you're going to tell her to get a mammogram and a pap smear, right?
Also, those protocols are not in place here.
They're not met here. I try to do my bit.
Yes,
I have a patient of a certain age. I get a PSA done.
Right.
Those are things I learned over there, and I just put them here. All the people are mainly coming for the diet.
Mm-hmm.
So, but I try to.
Right. So also I see that you're trained in bioidentical hormone replacement therapy, which is really interesting because traditionally we're not trained in that in our internal medicine programs and in medical school. So I'm just curious. I have an idea what that is, but if you would tell me what did you learn in that?
So you have to go through various courses. The mentor over there is Dr. Neil Rouzier, and I went through. Actually, I did it for my mother, and my mother was she had a hysterectomy at an early age, and I just happened to hear a talk of Susan Summers, and on TV one day, and she was talking about postmenopausal therapies and how women feel great and better. And I said I should do it for my mom. I did it for my mom, and I started. She was my first patient actually,
Okay.
and she turned around She was very depressed, and she had bone pains and knee pains. She could walk. She had no uterus for 20 years.
Wow.
So she had no hormones left.
Okay.
She lost her hair and everything. So she turned around, and I thought, man, if she can turn around, then maybe I can change some people's lives, because it's a very controversial. It is very controversial, this whole topic of bioidentical hormones. People are not ready to accept it, but people who actually, like Dr. Neil Ruzay, will actually teach you scientific, he'll give you scientific, and talk about bioidentical hormones. So it's a very controversial topic here and in America. A lot of people are not aware, but there is scientific evidence that it really can change people's lives, but you should know how to do it exactly. You make one mistake, you can kill someone. It's so careful. It has to be so careful and underdone.
Mm-hmm.
So it's one of the it's a magical way to say. I wouldn't call it anti-aging. I would call it a part of longevity.
Got it.
You know, so like I myself take progesterone.
Okay.
And I think before that
The reasoning behind that is?
I had a very bad PMS.
Okay.
So I had a really bad PMS, and I learned that and I just saw my levels of progesterone, they're bottoming out, and I don't know why, but they were. And then I started myself on progesterone, and I think every month I do some few days of progesterone, and I feel great. And progesterone, you know, is actually it prevents endometrial cancer and breast cancer. It's a protective hormone, so there's nothing wrong with it. So similarly, if you have to do estradiol or you have to do testosterone, there is a way to do it, and that there are people who qualify for the therapy. Not everybody is suited. It doesn't suit everybody.
Right.
So you can just. So I think bioidentical hormones is an amazing breakthrough. And eventually, I think by another decade, I think a lot of doctors are going to move towards that, because it's another preventing.
Okay.
You know, it's like a preventive sort of a medicine, and just very careful. Medicine.
Right.
Yeah.
Well, I'm really amazed that your mom was your first patient, because I'll be honest with you, I have my brother's also a doctor, and like if I say anything to my mother, it's like, oh no, I have to speak to my doctor. I'm like, but I'm a doctor. I'm like,
Yeah, no.
you know, I don't get any respect as a doctor in my home. You know that expression in Hindi, which I don't know how I will translate it, but it's that expression, ghar ki murgi dal barabar.
Yeah.
So my mom does not listen to me, but you know, I'm really impressed with your mom.
They were not listening to me. My father was totally against it. My father's surgeon, and he was very against it. He said, no, not doing anything. You're not going to do all this experiment on your mother. And I said, okay, let's try it for a couple months. That's it. And and then she changed. She was like, so before her medication was over, she would call me like 15 days in advance. My medication's getting over.
Wow.
Can you please prescribe me more?
That's good.
So my face is all the time, because my father's a surgeon.
Yeah.
And I'm medicine, I'm not surgery.
Right.
And he can't be medicine because he's a surgeon.
Right.
But still, all my relatives, my brothers and everybody, they first call him for a treatment.
They call my brother before they call me.
Yeah, so I'm an internist, but still they call him first. And it's changing, but it's taken time.
Yeah. Well, I'm. It's good that your mom actually listened to you, because obviously it benefited her. So now, for example, my patient in my practice is normally 35 plus, usually Caucasian, solidly middle class or up, and usually easily amenable to my suggestions. Who is your typical patient?
A housewife.
Okay.
She's usually about, let's say, between 35 to 45, and usually a lot of stress due to home or kids, or so my typical patients are housewives, middle-aged housewives.
Okay.
Most of them are like that, and then they pull in the husbands also.
Okay.
To get healthier. They pull in their children to get healthier. So my main patient is a middle-aged woman.
Yeah, but that's good, because once the family starts doing everything together, it becomes much easier.
Yeah, so the woman is the main, she's the main axis actually, and then she starts pulling everyone, and if she knows how to cook, I think everybody's health gets better,
right?
Because she's the main person in the kitchen. So she does the groceries, she does the cooking. So if she's targeted, and I'm glad that I have those patients, and with one patient I end up changing 10 lives.
Wow.
So
That's great.
that's too much of a benefit.
Yes, that's awesome. That's awesome. So this is like what I was really curious about, and I gotta say, this is probably the motivating question that I reached out to you because I am that child who grew up eating meat 3 times a day, and as I'm getting older, I'm very conscious of organic and being exposed, eating meats that have been exposed to antibiotics and God knows what kind of organisms and whatnot. So I am kind of moving away from eating as much meat.
Okay.
But so Indians in the Hindu population, they'll tend to be more vegetarian because that's a part of the religion and culture.
Yeah.
So how do you manage your vegetarian population?
Oh, I think my patient base is mostly vegetarian, and I had to change my mindset because I'm not a vegetarian. And for me to work it all out again, it's taken me a couple of years to work it for the vegetarian population because I was never a very big vegetable eater myself, and I never learned it that way. So when I was doing my obesity fellowship, I learned about packaged foods which are better. I learned about meats and chicken, lean fish, lean this. I didn't know how to work with vegetarian people because they practically in India especially, vegetarians eat less vegetables and more carbs. So when you say a Hindu typical housewife comes to me, she's carbitarian. She's not a vegetarian.
It's very true.
Yeah, so
very true.
they probably eat 4 vegetables and probably only this much amount.
Yeah.
So yeah, it had to turn. So I increase their vegetable servings to a very high level because now we don't fear fat. You know that. We don't fear fat
absolutely,
anymore, right?
absolutely. Fat is not the enemy. Sugar is.
Yeah. So I don't fear the fat. So even if they've cooked it in oil or ghee or whatever, I let them have like 2 cups, 3 cups in one meal, and then I work on the type of flour and add some protein to the flour.
How do you do that?
Basically chickpea flour or amaranth or buckwheat.
Gotcha.
So
Okay.
I use the alternate flours a lot,
Mm-hmm.
and then I use a lot of quinoa and lentils sparingly, not much because they are condensed calories.
Yes.
So if I ask someone to take a cup of dal, they end up taking more lentils than usual.
Mm-hmm.
So they end up gaining weight instead of losing weight. So I portion it out.
Sure.
So I portion out there. So basically I work a lot on soy. I have a lot of a lot of vegetarians eat egg here, so I can use a lot of egg. And quinoa I use alternate flours and tofus and all that. I use a lot of those. But in some patients who are pure vegetarian and are really obese, I use whey powder a lot.
Gotcha. Now I have to look into whey powder for myself.
Yeah, I do use that.
I have to look into that for myself. So now I was looking, this is really cool, and I thought I would ask you about it because for your office, you have your patients follow an app that's called Live Fit.
Live NutriFit.
Live NutriFit.
Yeah.
And did you develop that yourself? Or
Yes.
That's really cool.
So we had an IT team obviously working with it. So the basic principle is based on your weight and height, there is a certain portion that will be given to you to eat, and based on how much you want to lose. So if someone tells me that I want to lose 20 kgs in a month, that person's out already. We don't take those patients. You have to have like a 2 pound a week kind of weight loss, and we work on portions and we work on foods. So people can actually choose whether they want to have vegetarian, and we have like 5 cuisines developed.
Oh, okay.
So we have continental, Chinese, Mediterranean, and Indian and South Indian.
Okay.
So we have like that. So if someone wants to choose a certain kind of food, and they can even choose gluten-free, non-gluten-free, egg-free, nut-free. So we have all that. So patients can actually choose it, and it took us a year to develop it, but now my life is easier because I have so many recipes and everything is all done. It's done. So all I have to do is put in their credentials, put in their height, weight, whatever, and the medical history. And it's actually common for people with hyperlipidemia or diabetes, or people who want to lose weight. So they all come under one.
I should do this over there. I should do this app over there, and it can be done. It can be done anywhere.
Yeah,
no?
it can be done anywhere.
That's really cool. And now, as I'm getting older, I'm really into strength training because as we age, we have loss of muscle mass, bone density, and for women, I feel it's really important. There's this misconception that women can get super muscular.
No,
It's just not possible.
No.
And And I would rather have muscle under my fat than just be really fat, right?
Yeah.
So, and I also feel yoga and stretching is really important because we lose a lot of our flexibility as we age.
Yeah.
So, what do you encourage your patients to do?
See, I see if they've never exercised before.
Okay.
So there's always a first step. So most of my patients are so sedentary, they don't even walk. So first is walk, and second will be stretches, and third will be some form of cardio or strength training. So depending on, like morning, I had a patient who was 67 years old. She's not gonna do weights, I know. She's
Right.
never done it in her life. She's
Okay.
67, she has a chronic back pain. So I just told her to walk. So this is how I start. So I just one level or the other. And if someone reaches, like someone's lost 13 kilos and they are now ready to like hit the gym, then I let them go. But initially I never let them join the gym, because usually what happens, they start working on their own, they get injuries,
Yeah.
they don't take a proper diet,
Gotcha.
and then they just listen to the trainers who probably not so well and
Yes.
knowledgeable. So it's not, initially overweight patients should not exercise so much. I think they should first let their improve their lifestyle,
Mm-hmm.
see what diet they're having, and then try to lose some weight just by, because 70% is food.
Yes,
So
yes.
if they change
Absolutely.
that 70%,
Mhm.
exercise we can bring in later. We can bring in more strength training and all. So it's like a stepwise manner.
Right.
that I go, yeah.
So what Dr. Huda is saying is absolutely true. In terms of weight loss, everyone thinks you can exercise and you will lose weight. It's all in the kitchen, the weight loss business. Exercise is really important for health and for your
Insulin sensitivity
Yeah.
is very, very good for insulin sensitivity. So if you have a patient who has insulin resistance, when you start exercising, your body burns that same sugar is going to be used to increase the insulin. It's actually well utilized, and the insulin level doesn't spike up.
right.
That's very important.
So just remember nutrition. Nutrition is it if you're into the weight loss. So now your work schedule, because like you've trained in the States and you've worked here.
Yeah.
So like how does it work for you? Do you see the traditional internal medicine patient? Do you take call? Like how is your life?
Yeah, no, so my life's much easier than the United States, because here I just work 5 days a week. Like even in States I was, but then that was like I would start rounding at 7:30 there, and my day would end up at 5, and I would have to do weekend calls. And here there's no calls because I'm not attending the ER, I'm not doing ICUs, I'm not going to hospital rounds. So I just have outpatients, and there's no emergency in my field. So I'm traditionally not even seeing internal medicine patients,
Okay. So
except the volunteering. I have some, I do have some patients I see for, the poor,
okay.
or some, some kids, maybe a maid's kid or
Oh,
a
that's
driver's
nice.
kid and all. So those are my internal medicine patients,
Gotcha.
to be honest. Rest, yeah, of course, if I'm doing all the obesity thing, then a part of it is first internal medicine, and then I go into the obesity.
Gotcha. Okay.
Yeah. So that's all.
That's pretty cool. So, now, my last question. You've been so kind and generous to meet with me, take time out of your day. So I joke with my male colleagues, right? Because as a male physician, you can be a rock star all day, you can, do your thing and come home and everything is attended to. As a female physician, we don't have those luxuries because you're a doctor in the workplace, but the minute you walk home, you're still wife, mother, homemaker. Your
Yeah.
job never ends. So how do you find the balance between woman, physician, professional? How do you find that
One of
balance?
the hardest balances to find, I think. It's very hard because I see myself from one role to another, so constantly changing throughout the day. But I think the easiest part in India is because you have help.
Yeah, absolutely.
So I can do a lot of my paperwork while being driven to work. It takes about half an hour, 45 minutes from one place to another. So I'm being driven. So that adds to my time, so I can work. And then there is, you have a helper at home. There's a cook, and there's a cleaning lady who comes every day, not like US, just once a week.
Yes.
So we have, those kind of
Yeah.
things are perks in India, and they are very helpful. Then you can concentrate on yourself and your kids' education or whatever.
Right.
And the schools are, sending my kids to, it's much better because they do the homework there and come. So there is,
Yes.
we don't have that problem either. So yeah, so it's easier here.
Yeah.
Much easier. I mean, for you, I'm sure it's a bit.
I basically say I just need to I need to find a wife. This is what I mean.
Yeah. I know.
But yeah, so that's. I want to thank you so much. It's been so nice to meet you and taking time
It was
explaining all
my
these things.
pleasure. I want to talk all this all the time to so many people, but I think somewhere you're gonna put it on a web, or you're gonna
On my website and the
so
YouTube.
YouTube, and people can listen to it, and
We share. Even if you take one little thing away from this conversation, hopefully you've been benefited.
yes.
Thank you so much.
Thank
It was so
you so
nice to
much.
meet you.